If you have been feeling more tired lately, more dizzy when you stand up, or a little more forgetful than usual, I want you to pause with me for a moment. Please do not assume it is only age. Sometimes the body gives quiet little warnings before a bigger problem shows up, and one of the most common warnings after 65 is not getting enough water. The tricky part is this. Dehydration in older adults does not always feel dramatic. It can look like normal aging. It can look like poor sleep. It can even look like stress, blood pressure trouble, or memory changes. That is why this matters so much. Today, I want to walk you through 9 signs your body may need more water after 65, because catching these signs early can help you feel steadier, clearer, and more in control of your day. As we get older, the body naturally changes. We carry less water than we did when we were younger. We may not feel thirsty as quickly. The kidneys may not respond the same way they used to. Some medicines can make us lose more fluid. A hot room, a warm day outside, a stomach bug, or even just being busy and forgetting to drink can push the body into dehydration faster than many people realize. And here is the part many people miss. Mild dehydration can start affecting how you feel long before you feel very thirsty. So if you wait for thirst alone, you may already be behind. That is why I want you to listen closely to what your body has been saying. Has your mouth been dry more often? Have you been getting headaches, feeling weak, or walking a little less steady? Have you been waking up tired, even after a full night in bed? These may seem small on their own, but together they can tell an important story. And if you stay with me, I am going to share one especially practical habit near the end that can make hydration much easier without feeling like a chore. If this kind of calm, simple health guidance is helpful to you, take a moment to like this video, subscribe, and leave a comment telling me your age or the one symptom you have noticed most lately. I love reading your comments, and they help me understand what real concerns you and your family are living with every day. If you know someone who often says, "I'm just tired," or "I get a little dizzy sometimes," please share this video with them too. Sometimes one small piece of information can make a very big difference. One sign your body may need more water is a dry mouth that keeps coming back. Your lips may feel cracked. Your mouth may feel sticky. Food may feel harder to chew or swallow. You may wake up with a dry throat or feel like you always need to clear your mouth before speaking. Many older adults brush this off, especially if they take medicines that can also cause dry mouth. But when a dry mouth starts showing up along with tiredness, dark urine, or dizziness, it may be a hydration clue you should not ignore. Your body needs enough fluid to help with saliva, swallowing, digestion, and comfort. That dry feeling is sometimes the body's soft little knock at the door. Another sign is a change in your urine. This is one of the easiest clues to check, and one of the easiest to miss. If your urine looks darker yellow than usual, smells stronger, or you are going less often, your body may be running low on fluid. Many people do not pay attention to this because they are focused on everything else in life. But this simple check can tell you a lot. In general, pale yellow urine often means you are in a better range. Darker urine can be a sign you need more fluids. Of course, some vitamins and medicines can change urine color too, so this is not the only sign to watch. But it is an important one. A very common sign in older adults is dizziness or lightheadedness when standing up. You rise from the couch, and suddenly you need a second to catch yourself. You get out of bed and feel a little wobbly. You bend down to pick something up and feel off balance when you come back up. That matters because dehydration can lower the amount of fluid moving through your body, and that can affect blood pressure and balance. Even a brief spell of dizziness can raise the risk of a fall. And after 65, falls can change life very quickly. So if you notice this often, especially with weakness or less urination, think about hydration and speak with your healthcare professional. Tiredness is another sign that often gets blamed on everything except low fluids. But dehydration can make the whole body feel heavy. You may feel slow in the morning. You may feel worn out in the afternoon. Even easy tasks can feel harder than they should. Some people describe it as feeling drained. Others say they just do not feel like themselves. The body depends on water to move nutrients, support circulation, and help every system do its job. When that support drops, energy often drops too. Now, tiredness can come from many things, including sleep problems, anemia, infection, depression, thyroid issues, or medicine side effects. But if low energy shows up with dry mouth, dark urine, or headache, the message becomes clearer. Headaches are another quiet warning sign. Maybe not a severe, pounding headache, but a nagging pressure, a dull ache, or a heavy feeling in the head. Some people notice it late in the day, after not drinking much. Others notice it after sitting in the sun, spending time in a warm house, or drinking coffee and not balancing it with enough water. Headaches can have many causes, but when the body is low on fluid, the brain and blood vessels can feel the strain. If the headache improves after rest and better hydration, that can be a clue. But if you ever have a sudden severe headache, especially with weakness, confusion, slurred speech, or vision changes, that needs urgent medical attention right away. Now let's talk about something many families find surprising. Confusion, brain fog, or forgetfulness can sometimes be linked to dehydration. Maybe you lose your train of thought more than usual. Maybe you feel mentally slow, irritable, or less sharp. Maybe a loved one seems more sleepy, more quiet, or just not quite right. This is one of the reasons dehydration in older adults is so easy to miss. It can look like aging, but sometimes the brain is simply not getting the steady support it needs. Water helps with circulation and normal body function, and the brain is very sensitive to changes. If confusion is mild, start by thinking about fluids and other causes. But if confusion is sudden, serious, or comes with fainting, one-sided weakness, chest pain, trouble breathing, or trouble speaking, please seek urgent care immediately. Constipation is another sign many people do not connect with hydration. When the body does not have enough fluid, the stool can become dry and hard, and bowel movements can become difficult or less frequent. Then people start eating more fiber, which can help, but without enough fluid, fiber alone may not solve the problem. In some cases, it can even make you feel more bloated and uncomfortable. If you have been dealing with constipation, ask yourself a gentle question. Am I drinking enough through the day, or am I mostly waiting until I already feel thirsty? Also remember that some pain medicines, iron tablets, and other medications can worsen constipation, so it is always wise to review your symptoms with your doctor or pharmacist. Muscle cramps can be another sign that the body may need more water. You may notice your calves tightening at night. You may wake up with a foot cramp. You may feel your muscles get jumpy or tight when walking or stretching. Water helps muscles and nerves work smoothly. When fluids run low, some people become more prone to cramps. This is not always caused by dehydration, of course. Circulation problems, mineral imbalance, nerve issues, and certain medicines can play a role too. But if you have cramps along with fatigue, headache, or dark urine, hydration deserves a closer look. Another sign is feeling shaky, weak, or noticing that your heart seems to race more easily. The body needs enough fluid to help keep blood moving the way it should. If you are low on fluid, your heart may need to work harder. You may notice this when climbing stairs, making the bed, or even standing up too quickly. You might feel more short of breath with simple activities than usual. Now this is important. Mild dehydration can make you feel weak or a little off. But chest pain, severe shortness of breath, fainting, or a pounding heartbeat that does not settle are not things to watch and wait on. Those are reasons to get medical care right away. There is one more sign I want to include because it often gets ignored. Sometimes dehydration shows up as dry skin or skin that seems less springy than usual, but this is not the best sign in older adults because skin changes naturally with age. So I do not want you to rely on that alone. A better way is to watch the whole picture. Dry mouth, dark urine, dizziness, tiredness, headache, brain fog, constipation, cramps, and feeling weak or shaky. When several of these start traveling together, the message becomes much harder to miss. So what can you do in real life, in a simple way, without making this feel overwhelming? Start by making hydration easy and visible. Keep a glass or bottle of water where you spend the most time. Put one by your favorite chair. Put one near the kitchen sink. Put one by the bed if your doctor says that is okay for you. Sip through the day instead of trying to force down a lot at once. Many older adults do better with steady small amounts than with large glasses all at once. You can also build water into little daily routines. A few sips after waking up. A few sips with breakfast. A glass with lunch. A few sips after taking a walk. A drink with dinner. Small habits are often the ones that last. And here is the practical tip I promised you earlier. Do not rely only on memory. Link drinking water to things you already do every day. That is the secret. Tie it to brushing your teeth, taking medicines, feeding the dog, watching the morning news, or sitting down for meals. The brain loves routine. If hydration becomes attached to habits you already have, it stops feeling like one more thing to remember. This can be especially helpful for older adults who live alone and for caregivers trying to support a parent or spouse. Sometimes the best health habit is not the fanciest one. It is the one that is easy enough to repeat. Water-rich foods can help too. Soup, berries, melon, oranges, cucumber, lettuce, yogurt, and even oatmeal can add fluids in a gentle way. Some people find plain water boring, and that is very common. If that is you, try water with lemon, cucumber, or a few slices of fruit. Some people enjoy warm herbal tea. Others prefer cool water in a bottle they can carry from room to room. The goal is not perfection. The goal is a pattern your body can count on. But I want to add a very important note here. Not everyone should simply drink more water without thinking. If you have heart failure, kidney disease, liver disease, swelling problems, or if your doctor has told you to limit fluids, then your hydration plan needs to be personal. The same is true if you are on dialysis or take water pills. More is not always better for every person. That is why it is a very good idea to ask your doctor, nurse, or pharmacist a simple question. How much fluid is right for me based on my health conditions and my medicines? And please, never stop a prescribed medicine on your own because you think it is making you dehydrated. Always talk with your healthcare team first. It is also smart to pay extra attention during higher-risk times. Hot weather can dry you out quickly. Vomiting and diarrhea can cause fast fluid loss. Fever, long walks in the heat, or sitting outside for hours can do the same. Some people get dehydrated after a poor appetite day, when they are not eating or drinking much at all. Others get into trouble because they are afraid to drink in the evening to avoid nighttime bathroom trips. I understand that concern. But when you cut back too much, the body can pay the price the next day with weakness, dizziness, or confusion. Sometimes the answer is not drinking less. It is spreading fluids out more wisely. If you are caring for an older parent, spouse, or loved one Watch for behavior changes as much as physical signs. Are they more sleepy than usual? More irritable? Less interested in food? Walking slower? Using the bathroom less? Saying they feel off, but not knowing why? Those can be meaningful clues. Sometimes a caregiver sees the pattern before the person does. And that gentle observation can help prevent a hospital visit, a fall, or days of feeling miserable. The hopeful news is this. Hydration is one of those small daily habits that can support many parts of health at once. Better hydration may help with energy, digestion, focus, balance, and even how steady you feel moving around your home. It may help you feel more confident leaving the house, going to church, enjoying time with family, or taking that walk you have been putting off. These are not dramatic miracle promises. They are simple, sensible improvements that come from giving your body what it needs. So tonight or tomorrow morning, take one small step. Notice your mouth. Notice your urine. Notice your energy. Notice your balance. Ask yourself whether your body has been whispering for more water. Then make one easy change you can actually keep. Maybe it is a glass when you wake up. Maybe it is a bottle by your chair. Maybe it is adding soup or fruit to your day. Small changes are often the most powerful because they become part of real life. And if this video helped you, please subscribe, leave me a comment, and tell me which sign surprised you most. I would also love to know what small hydration habit you want to try this week. And if you have a loved one over 65 who often says they feel tired, dizzy, foggy, or constipated, send this video to them with a simple note that says, "I thought of you." Sometimes that little act of care is exactly where better health begins.